So thank you guys for joining us. My name is Sergio. I'm a current PA, and I have my partner Jacob here. We're the founders of myPAbox, and today we have Candace Whitley. She is the admission coordinator of Middle Tennessee State University Physician Assistant Program. We're just going to be kind of learning about her program, and kind of take it from there. Hopefully you guys find this insightful. Make sure you like, subscribe, comment below if you have any questions for Candace or for the program, and we'll start from there.
So, Candace, where did you start your PA school and how long you've been practicing for? Start with a little background about yourself.
Okay. I actually went back to school a little bit later in life, and I went to PA school in Nashville at Trevecca Nazarene University. Graduated in 2004, so I've been practicing a little over 18 years. I decided that I've been practicing internal medicine the entire time. Decided a couple of years ago that I wanted to kind of stretch my legs in the administrative side of things, educational side of things. So I went back and got my Doctorate of Medical Science and finished that last December. Ran across this opportunity at Middle Tennessee State University. It's right in my backyard, and so took the opportunity to come on as staff here as the admissions coordinator. I still continue to see patients 1 day a week, and then the rest of the week I do this. But really enjoy kind of both sides of the road, patient care and administrative.
Awesome. That is amazing. So tell us a little bit more about the Doctorate of Medical Science. You know, there's a big buzz around it. What were the benefits of getting that degree clinically or, you know, from an administrative perspective?
You know, I never really thought too much about going back and getting my doctorate until I started seeing special needs adults. For the past 10 years, I've seen adults with intellectual and developmental disability. And I ran across this program, Rocky Mountain University in Utah, and it is specifically for PAs, Doctors of Medical Science, and they have 3 different tracks. Mm-hmm. One of the tracks is advanced clinical practice. So in order for me to kind of take a deeper dive into my particular patient population, that's the course I chose. And again, it just kind of sets me up personally, and I think other PAs that are interested in continuing to have patient care, continuing to have then explore administrative opportunities, explore educational opportunities, just to have a little different role, especially if you're interested in PA education or higher learning education. So that was really my driving and motivating factor was really around my specific patient base.
Awesome. So someone basically wants to get a little bit more deeper into that particular specialty that they're practicing in, you would recommend it. So this way.
Right. Okay. Absolutely.
Would you recommend for a student to pursue this right after college, or is this something that you would recommend later on in your career once you kind of get settled into your specialty and kind of understand, you know, what you really want to hone into?
Right. That's a great question. I personally recommend that you get out as a PA and you get some experience. You know, get in that clinical setting, get in the OR, get in, you know, wherever you are passionate about serving, get some experience, see how everything works, see how the insurance works, see how, you know, the administrative side of the office and the OR and the hospital works. One of my colleagues in the doctorate program was fresh out of PA school, like literally just graduated and then started the doctorate program. And she did quite well. But, you know, the other colleagues in the class, in the cohort, we had at least 5 years of experience. And sometimes in discussion and things like that, we had been through some things and she had not been through those things yet. So again, she did really well,
Yeah.
but I think it just sets a better foundation, you
Awesome.
know, to go get a little more experience.
Right. I agree with you 100%. I actually want to ask that question. Coming out of school, did you set your expectation that one day you're going to be in an administrative role, or you that kind of like stumble upon you?
That it was a kind of a stumble upon. Yeah.
Hmm.
Um, uh, I am not a corporate minded person. I'm more of a small, you know, small town family feel. That's how I work best. That's how I communicate best. I don't really see the reason to have 15 meetings, you know, about something. So, you know, let's just sit down and talk about it and hammer out the details and let's
Right.
get it done. Um, so yeah, it was kind of a surprise to me that I was pretty much called to pursue this doctorate. And again, I think one of the funniest things is I had several friends, you know, well, are you going to make more money?
Mm.
I have no idea. I have no idea. That's not my purpose. That's not my goal. My goal is to learn more about my patient base so that I can serve them better. Um, and I think if I have one, you know, word of advice, you know, to outcome to new PA students, to new grads, um, don't get promoted outside your passion.
Mm.
You know, go with what you love, and you're going to find out that maybe that first thing that you thought you loved and wanted to do is not, and that's okay. Um, so yeah, you've always got to follow your passion, because that's gonna provide everything you need.
Absolutely. I think that's really good advice, because especially after practicing, you know, so what I used to precept students, and I would tell them, you know, you're in the honeymoon phase of learning medicine right now. It's like you're dating, right? You're getting to know
Right.
everything's exciting, even the simple suture. Then after 4 or 5 years into it, you truly understand what you actually enjoy practicing. Like, for example, before I got into PA school, I thought I only wanted to do cardiothoracic surgery or surgery. I picked 3 surgery electives, 2 general surgery and 1 cardiothoracic. But by the time I got to cardiothoracic, yeah, it was cool. But it was like, okay, surgeries is the same thing every single day. And
Right.
for me, my personality, I like more of a variance. I like a chaotic environment and finding control in it. And I gravitated more towards urgent care, ambulatory medicine, where, you know, you don't know what's walking through that door.
Right.
So that, I totally agree with you on that. You know, definitely find your passion. That's really good advice.
Yeah.
Yeah. So
Yeah.
tell us a little bit about, as far as your role at Middle Tennessee State University, and how you got, you know, situated there, and what you're doing, and a little bit about your program.
Well, the program is new. We just took our first cohort of 30. They started this May of 22. We're in the process of interviewing for the next cohort that starts May of 23. Like I said, you know, after getting my doctorate, I kind of just started looking around to see what was out there, and found this. As it turns out, the director of the program, she and I went to PA school together. And when my
No way.
yeah,
Wow. What a small world.
yeah, when my CV crossed her desk, she thought, "Oh, this name is so familiar to me. I think we may have gone to PA school together." Anyway, we ended up doing the interview, and then she said, "You know, this would be amazing to have a PA as the admissions coordinator, just because, you know, you've been there, done that." And that's, you know, again, it's not about money. It's about, you know, just doing what you love to do, and taking a chance, and jumping on an opportunity. So anyway, I came on board in April of 22, April of this year, and learned CASPA, and just have a tremendous amount of support around that. Love interacting with the students. I'll do you know, pre-professional health fairs. Once a semester, I'll do an informational session or open house here at the university. It's about a 45-minute PowerPoint presentation, and then we do a little tour of our laboratories and facilities and that kind of thing.
Mhm.
So really enjoy that interaction with the students. And again, it's just the perfect fit for me and where I am in my career, and at my stage of life, kind of the back end of my career. So it's the perfect fit. Yeah.
That's awesome.
Let me ask you a couple of follow questions. So I know you said your first cohort was 30 students. The next cohort is also 30? Because I know
Yes.
sometimes CASPA, or not CASPA, ARCP allows like a specific number the first year, and then the subsequent years they allow it to increase the capacity. You
Right.
guys are still going to be at 30?
We're keeping it at 30 for at least the next 5 years.
Got it.
Yeah.
Okay.
The faculty and administration just feel like that to keep it kind of small that way just
Right.
makes for a better learning experience.
Absolutely.
Yeah.
Especially for a provisional school. I kind of agree with that. Until you guys get like the ball rolling and everything's kind of well-oiled machine.
Right.
It's probably best to start with a smaller capacity and then kind of increase your way up.
Right.
So cool.
Right.
In terms of the it's a virtual tour that you do once a year? Or
No, I've done 2 of them already, and they're in person. Yeah.
they're in person. So these are students, pre-PAs from where coming in?
Pretty much all over. We'll post, do like an email blast locally, and then we'll do a website posting. I had a interested student drive in about 3.5 hours from Georgia to attend the open house and session, informational session in October. For
What's
the
the
most part, I'm sorry.
No, go ahead. I'm sorry.
For the most part, it's local. They might drive in from an hour and a half, Middle Tennessee, East and West Tennessee. But yeah, we've had a few drive in, 3 or 4 hours away, just for the informational session.
Understood.
Maybe we can help you guys in the future in terms of sharing that information so you get a bigger turnaround. So we'd be happy to do that.
I was actually going to ask if you guys, did that kind of thing.
We do. We
okay.
do. So we host. So if schools let us know that they're doing some kind of open house, and they want us to advertise it, we're all for it. So
Okay.
we're, again, the audience that we have are pre-PAs. So those that are interested in that particular state or from out of state and they don't mind traveling and they want to learn, by all means, we're all in it.
Okay. Perfect. That's great.
So I have a question. So as far as, say, if I'm a pre-PA student, I'm looking at which schools to apply to, and I see the provisional school program.
Mhm.
I might be a little bit wary now as far as applying to it because it's relatively new, things like that. But what makes a program, like, for example, what is your particular program? I know you can't speak for all programs. How are you assuring that the students are graduating and even though you're provisional status and they're going to be able to take their boards and things like that?
Well, I think the simplest answer is if we didn't have provisionals, if we weren't accredited, we wouldn't have students.
Right.
And I had that question come up from a student a couple of months ago. He was a little leery of the provisional status, and I said, basically, we are accredited. We are an accredited body. It just means that the accreditation is going to come in 2 years instead of 5. It just means that, they're going to come in a little bit sooner, make sure we've got all of our I's dotted and T's crossed. But if we did not have accreditation and have the tools and the means by which to get you through the program, to get you graduated and to get you on your, to pass your boards, we wouldn't be able to take students. So, and again, I think my biggest take home point is it just means ARC PA comes in a little bit sooner than your program that's been around for 15 years.
Absolutely. Yeah. And I think that's a very good point. That's what we tell students as well. It's as long as as a program is accredited, probationary, that's where you have to kind of, do a little bit more investigating as far as when they're due for the accreditation test. But provisional really is that you have all your ducks in a row and you're ready and you're a well-oiled machine running to
Right.
graduate students, so which is good.
Right.
So
Right.
we get to ask that a lot as well. So.
Yeah.
So in terms of, you guys obviously are in Tennessee, would you say your school stands out in a particular way from other Tennessee programs?
The biggest thing that I noticed pretty quickly was, our mission statement really has a lot to do with a couple of different things that stood out for me: diversity and serving the community. Part of the first semester, there is time built in to the students' day, usually on Fridays, where they must go out and continue to do their community service.
Wow.
So community service is really big. Doesn't have to be in the medical field. Doesn't have, it can be anything, again, that if you're passionate about animals or the elderly or, the environment. So that's built in
Into the program.
Into the program.
So every Friday you basically, they have a set way of, hey, we're going to be going here, or do you guys provide like certain scenarios for them?
They are able to choose what they want to do, but instead of Friday lasting until 4:30, the class, the day ends at noon. Now you're responsible for going and getting your, and they have to have proof. They have to turn in their community service. Yeah,
that's awesome.
So that and diversity. We have this first class of 30 is really diverse, and that's just so incredibly important. And we have a lot of really cool technology here. We want to be grassroots. We want to be family oriented. We want to be, kind of this small community base, but we've also got to stay on top of, all of the latest and greatest technology.
So give us a little heads up about the technology. So give us, what is that you guys have?
Well, I'll tell you a funny story about myself. I'm not too much into, techie stuff. So I was here for about a month or so, and somebody came running the office and they said, "Candace, our animage tables are here." And I was like, "That's great. What is that?"
Yeah, I was going to ask you the same thing. I'm like, never heard of that.
You haven't?
No.
They are, have you heard of it?
Yes, I have.
Okay. They are like, we have two of them. They are like giant iPads. They lie flat, they'll tilt, and literally it looks like a giant iPad. What they have done, what this technology has done, is it is true cadavers of every ethnicity, every size, shape, color, that they have taken photos of cadavers. And it's even more than MRI photos, more detailed and more specific. So you're able to see this cadaver lying in the anatomically correct position, and you're able to remove with your finger, point, click, and drag, remove part of the skin. And you're seeing muscle, you're seeing tissue, you can rotate it to be a 3D. You can remove, part of the thoracic cage, and you can see what's in there. It is.
If only we were able to do that in life surgically, that simply.
Right.
Let me ask you a follow-up question. So you guys don't actually have a cadaver at the school. You guys use this virtual, or you do?
We have both.
Oh, that's amazing.
I was just going to say, that's one of the most beautiful things about it is in the first semester, we do have a cadaver lab. I think we have either 3 or 4 cadavers. And after the cadavers are finished in the summer, the student still has access to that animage table that gives you, they have access to it 24/7 to continue that, that learning process virtually.
That's awesome.
Yeah, that's amazing because you get to see it physically, and then you could still continue to process that after.
The feel of it physically is different. It has the smell of the formaldehyde, the whole nine. It gets you. You're like, I know what that is.
Right. Just saying cadaver lab, and I can smell it. Yeah.
Yeah. Right.
Exactly. We unfortunately didn't have it in our school. We went to school together. We had it in the building, but it was a different department using it. So we just went there, I think, once just to kind of take a look at
But
it. But it was pretty cool.
Yeah, what Toro did have is they had a day where a group of us would go to the Nassau County Medical Examiner's office, and we saw actual live autopsies.
Yeah.
So we were seeing, arthrosclerosis real time, and just having them go through all the pathologists go through all that. So that was very good for us.
Community service stuff. I haven't heard any program. Again, I haven't interviewed all the programs to know about it, but I don't know of any program thus far that requires it during the PA program.
Yeah,
that's amazing.
So it also, look, I speak to a lot of PA students as well. It also gives them a little bit of time to unwind from being 24/7 in the books or actively learning. This gives you, if you're going to go to, for instance, a nursing home, you get to interact with people on a level that is different than, you can probably start applying some of this information because you're seeing it live.
Right.
In your in your didactic year. Forget about clinical. Clinical, obviously, that's the point of it. That's awesome. And then the diversity aspect of it, obviously the virtual cadaver aspect and the live cadaver aspect, it's pretty awesome.
And we also have several task trainers, joint aspiration, central line placement, a lot of different task trainers that, again, students have access to 24/7. And I almost forgot this. I'm glad I remembered. Each student is given to it's theirs to keep forever and ever, a butterfly ultrasound.
Oh, wow. Which isn't cheap, by the way.
Yeah. What's that?
Which is not cheap.
No.
Yeah.
They range from $1,000 to $2,000 plus.
So each student is given one of those. And
are you guys actually training them how to use sonographic guided? That's awesome. So a lot of schools don't do that.
Yeah.
They give you maybe a sim lab or something like that where you get familiar with it, but it's not something like I do pain management. So sonography and a lot of injections go hand in hand.
Right.
Especially nerve blocks. So you kind of have to know your anatomy.
Oh, yeah.
But again, I know it from a pain management realm. There's so much more you can do with a sonogram outside of that. I just kind of know my niche. Yeah. But it's great that you guys offer that. We didn't have that. I learned that as a skill outside of PA school.
Yeah, so that's matter of fact, I think I'm going to proctor one of their finals today, and I'm not sure if it's that one or not. But yeah, it is taught, and again, it's theirs to keep. I mean,
that's awesome.
Yeah.
And correct me if I'm wrong, Candace. Your program is the most affordable program in the state.
Yes. Okay. Yes. The most affordable in the state. It's a public university. I think, when you talk strictly books and tuition, it's about $65,000.
Wow. Yeah.
So you guys are a public university. It's not a private school.
It's amazing.
So public, you mean, is it necessarily a city or a state school or no?
Well, it's Middle Tennessee State University. So it is
state school
under that. Under that umbrella.
Gotcha. So
the title gave it away.
Yeah. As far as any standardized exams to apply to the program, like the GRE or Casper, PA CAT, do you guys require any of those type of exams?
No, don't require any of those. No.
Okay. How about patient care experience? How do you guys value that? Is there some minimum hours?
I'm really glad you guys asked that question because I run across this quite a bit in reviewing applications. I think the biggest point is a medical scribe does not count as direct patient care. I think the other really good point to bring out is, I might be an MA working in an office, and I might be working with or for a PA as their MA. We really don't consider that to be PA shadowing. We look for, we were talking about direct patient care.
Correct.
Right?
Yes.
Okay.
Patient care experience.
Yeah. Direct patient care is more hands-on. I mean, taking vital signs, checking a blood glucose, administering an EKG, helping patients with ADLs, physical therapy technician, helping with exercises, but it needs to be hands-on.
Understood.
I have a specific question. I had a student that I spoke to the other day. She's an orthotic MA. She works to create, I guess, special orthotics for, post-surgical or, anyone that needs that. Would you guys consider that as hands-on? Because she obviously has to cast it on the patient. So that is direct patient care experience. She does touch the patient, but again, it's like that fine line. She's like, I'm not sure, because a lot of schools don't list that as a. I'm like, but I would say that is, because you're literally touching the patient, and that's what they want.
And here's the advice that I would give that patient if she were to ask me. I would say there's a part in CASPA where you can write out the details of what you do.
Right.
Be sure to make sure that you detail what you do
day-to-day
with and for that patient.
100%.
Yeah. So, and I've kind of nudged some people along that, I read it in the details, but I need just a little bit more. So I email them and say, let's expand on that. Give me just a little bit more. You're right there.
Right.
Yeah.
And I think that's very important. A lot of students overlook the description part of
exactly.
and that's really how the programs determine whether your experience would be considered patient care, direct patient care, or health experience. So that's very important.
So this is actually a point that was brought up during the CASPA review session that we had with the patient. With a pre-PA student. So she purchased one of the services that we give just to review the CASPA application. And this is one of the reasons. Listen, I don't know. And I'm like, no. You just need to rephrase it and actually write exactly because in your head, you're trying to not be deceptive, but trying to tell them what you're doing. But you can just be very, very straightforward and say, listen, this is what I did. And it's considered that. The school values it, you'll know about it. But be descriptive. Sometimes you think it's not something that I should mention, but that's actually exactly what we want to know.
Right. Right. I looked at an application yesterday about PA shadowing, and all they said was observe the PA's daily routine.
What exactly did you observe?
What did you get out of that observation of the daily routine? So, it's, and again, if the student reaches out to me and literally ask, well, what can I do better? Okay, I will absolutely share that information with you, that this is not enough. You need to expand on this. Absolutely. Tell me what you got out of your experience.
Yeah. This is very valuable advice. Yeah.
I'm not asking for a novel, but I'm asking for, tell me what you learned. What did you experience? What did you see?
Absolutely. Yeah. This is very valuable advice for pre-PA students.
I'm actually writing this down myself.
Yeah.
For other reasons later. But this is a great point.
Good.
So tell us about, you mentioned PA shadowing. So your program does require 40 hours, correct?
Recommends 40. Yeah. And like I said, working as an MA, as the MA for the PA, we really look for dedicated time. And the best example, I had a student that, this was just perfect. Her direct patient care, she worked as an MA. She worked in an office and was an MA for the PA. But in her PA shadowing, she said, the PA that I work with and work for, I would stay after hours and shadow him, away from her regular duties, and focused in specifically on, this is what he does. These are the questions he asks. These are why he asks. This is how he does his note. See the documentation afterwards. See the follow through afterwards, because her role as his MA was this. So she needs to see, that dedicated time. We need to see that dedicated time that you took to follow that PA through the entire day through the entire process.
Understood. Yeah. So that's
Right.
another very good point, because a lot of students kind of ask like, hey, technically, can I quote unquote, double dip? But it's not really double dipping. It's like, okay, you have your time of when you work as an MA or PCT,
Right.
and then you can still be at the same facility, and put that down, but it needs to be separate from.
Exactly.
That's actually a very good point as well.
Yeah.
Do you guys have, I know there's a lot of hard requirements in terms of, okay, you must have a minimum GPA or X amount of prereqs. These prereqs must be filled. Does the overall program have a holistic approach?
Yes.
You do?
Yeah.
Okay.
Yeah. I like to explain to students kind of the flow of things. They'll fill out their application. Once they, pay the fee and it's verified through CASPA, the first step is it goes to the graduate college. The graduate college does what they do. It then comes to me. I have certain things that I look at and review. From that point, then I'll turn it over to faculty. We've got 5 faculty that review applications. They run through it from top to bottom and score it from a holistic standpoint. And it's amazing how the numbers come out, how the data comes out. It works to score applications from, your GPA gets so many points, your direct patient care gets so many points, your letters of recommendation get so many points, your essay, personal statements, what is the content? What's the grammar? What's your punctuation? What is your story? All of that drives a score. Once it's scored, then the faculty send all the scores to me. We run a spreadsheet, and the top 24 scores float to the top, and that's who gets an interview invite.
Got it.
Gotcha.
Yeah.
So the way you guys approach it is the whole is always greater than the sum of its parts.
Yes.
That's awesome.
Yep.
Yep. That's amazing. So are there any supplemental applications required for your program?
No.
Okay.
And I kind of had to figure that out on my own, because I didn't realize that some schools or they want a graduate school application plus their PA application,
Right.
and each has a fee, and we don't do that. It is just the CASPA PA application with the fee.
That's amazing. Yeah, and the fact that you guys don't have any standardized exams as well as no supplemental applications, that's very big, because it's obviously very expensive for students to apply between CASPA fees and things like that. So that's amazing.
Yeah.
So just quick questions. How many applications did you guys receive in your previous cycle?
In our first cycle, we had 477. In this cycle, we had 850.
Wow.
So obviously, I think even next cycle in April, we'll see that.
Yeah.
You'll probably see another double.
Yeah.
Usually, from the programs that we speak to, they average at least 1,000 applicants per program, if not more. Like, that's usually their base. Out of that ballpark figure, this is a very common question that I try to tell students, that you guys don't understand that when you apply to multiple schools, this is your biggest thing that you're starting to miss. You're starting to miss basic information that they want you to have completed. You missed this requirement because you applied to 10 schools and you kind of, put on the back burner. I think I did it, or I did it, but then something changed. From the 400 applications you guys had the first year, what would you say, again, ballpark, doesn't have to be exactly, that a percentage of those people that they just didn't meet your criteria, or something was lacking there that, okay, we have to pull this aside? Or is it because you guys are a holistic approach, you guys don't do that?
And honestly, I'll have to answer that from this cycle, because I wasn't on board.
Got it.
With that first cohort. Yeah. So with this cohort, this is 855 applicants. I think one of the things that I get the most, and it surprises me so much that it's missed as part of our requirement, is for prerequisites, it's a requirement for a B- or better.
Mm.
And that is missed so often. It blows my mind. Yeah. I'll be sitting here and reviewing applications, and I'll get an email. I want to clarify the requirement not met. I did take microbiology. And to myself, I say, yeah, and you probably made a C.
Mm.
And then I go pull up their application, I find microbiology, and they've made a C. So, and then I have to then go back and break their heart and say, it doesn't meet the B- or better requirement. So it's details. It's details. And I, thinking about and seeing what you guys are doing, oh my gosh, I wish I'd have had that when I was applying to 6 different schools. Just to have all of that information right there. I hate spreadsheets. I'm getting used to them, but to try to keep a spreadsheet of all of the PA schools and all the requirements, that's just, the way you guys have just brought it into one. And you want to apply to University ABC. Here are their requirements. Do you meet their requirements? You don't meet that one. Throw that one out. It's just it's made things very simplistic.
I'll tell you from our standpoint, because we're past it, we can see how much sense it makes. But when you're pre-PA and you're kind of like there, not all gears are, I don't know what it is. It's like they're not all working at the same time.
Right. Yeah.
They're biased towards themselves. Like, they'll overlook it.
Right.
Or something like that, which I totally understand. But that's wishful thinking.
And that's the thing with medicine as well, right? Like, oh, I can overlook this patient's murmur that I'm hearing, right? Like, and I remember when I was in organic chemistry, we took our second exam, and everyone did horrible, and we're all complaining, like that was such a hard exam. And the professor, she's like, okay, let me tell you how many of you guys are pre-med or pre-PA? And we all the whole class raised their hand. And she's like, the number one thing that organic chemistry teaches you is attention to detail. Like, I don't know if you remember chirality, just the shape of one carbon being off will completely change. And in medicine, it's that attention to detail, whether it's for your patient or that mole that you notice that could possibly be cancer, things like that.
Right.
So, and it's the same thing that Jacob and I tell, in our pre-PA club meetings and things like that, is that you really have to be very meticulous about what is required and what is recommended and what is preferred. Paying attention to that language.
Right.
And it's the same thing when you're taking an exam question, for example. What is the best diagnostic test, or what is the initial diagnostic test, will completely change what your answer is for the same exact question.
Right.
So I think it's that paying attention to detail, even from early on in your career, is a very important factor in the rest of your career as practicing medicine.
And it's absolutely about, and this is across the board in life, it's about finding balance. You certainly, you have to pay attention to detail. No question. Just don't get wrapped up in it, because you get wrapped up in it, then you start getting bogged down and you don't go anywhere. So, it's finding and learning that balance. And I remember, my first clinical and being taught that your exam starts right when you walk in the door, because you're laying eyes on that patient. Are they in distress? Are they clean? Are they well groomed? Are they, how do they look? It starts right there. So
that is so key. And unless you're like a practitioner yourself, you don't have that skill. Or people, it's a fine-tuned skill. Like, my wife says this all the time. It's like, how do you notice it? I'm like, how do you not notice it?
Right.
How do you not notice it? Like, it's right there.
Yeah, literally, that's such a good point. Like, patients will be walking by and just,
I already know what they're here for.
From their cough, I'm like, oh, that sounds like it's pneumonia,
Right.
So that's actually a very good point.
I see a patient on my schedule. Oh, been coughing for weeks, and I hear them come in. They've been here for 20 minutes. I hadn't heard a cough one. I mean,
Yeah,
but it's the
yeah,
worst thing ever. So
yeah,
yeah.
yeah. So that
But yeah, those are all just skills that that come along with it, but I think the application process is a good place to start with attention to
Filtering
detail
through all that through the
yeah,
applicants.
yeah,
It's
yeah.
actually very yeah.
Out of the 800, Candace, how many students were called in for an interview since you took over?
We do 4 interview sessions, and we do 24 students at a time. So was it 96
Right.
for 30 seats?
And what's the interview style of the program? Is it like more of direct, or like you have stations?
It is a day long process, and I'll tell you, it changed a lot since I went to PA school. My interview lasted about an hour, and I went home.
Mine too.
And we've got breakfast set up. We've got we're giving T-shirts and all kinds of goodie bags, and but we have it set up to where we do a quick introduction, kind of 15-minute orientation to how the day is going to roll. Then the 24 applicants are divided into groups of 12, Group A and Group B. We do an essay. We do a group interview, which is with 4 students at a time, and then 2 individual interviews. Those individual interviews take place with a community PA and a faculty member. So
Right.
Interesting.
Yeah.
The community PA is not a member of the program.
No.
They're just there for that day to kind of tune in, help
Wow,
out.
that's very interesting.
And we also send out 2 or 3 weeks before the interview. I send out to the community PAs, the list of applicants, and if there's any type of conflict of interest, or hey, I know that person, or they shadowed here, then I'll arrange the schedule to where that person is not with that PA.
Awesome.
Interesting.
Yeah.
You just gave me an idea to do something on myPAbox. Then we should be putting these videos into the particular school, so when students are researching this school or save the school, they can get to watch this interview.
I was thinking that in the morning. Exactly what we just said is that we should.
See, that's how you and I are partners. Honestly, we think on the same wavelength so many times. It's crazy.
Yeah.
But as you're saying this, it was like clicking in my head. I'm like, I would want to know this information. I didn't know this information about my PA school when I went there.
And this information, Candace, that you're giving, it's like you can't get that from the website.
You're not going to get that from a website.
Like this is such valuable information that you're giving, especially for someone that's interested in applying to your school.
Yeah,
that's really amazing. So, what qualities do you look for in what's your ideal PA applicant?
Looking at holistic scores, and looking at how people kind of fall into the score. We just really look for authenticity, humility. And I think that's another thing that we really instill in the students right off the bat is certainly you have to have confidence, but you have got to have a humble confidence. You've got to maintain your humility in the confidence of the work that you do, because you're here to serve, and you are serving people that are not in a good place. And so I think that's really what faculty looks for is realness and drive and grit, because things are going to get tough. And how do you handle that? I myself, I'm a kind of an old retired athlete. I've been very athletic and active my entire life in organized sports, and so a lot of dedication and a lot of this is what needs to be done. What does it take? Okay, that's what I'm going to do. This is how I'm going to do it. So, what's your attack strategy? What do you do when you're just absolutely emotionally and physically worn out? So I think that's some of the biggest things that really stand out for us, is just being genuine, authentic, and humility is huge.
That's
Can I
awesome.
apply to your school now?
You're in.
So let me ask you a question. So you said that you went down the PA career much later. Was sports or your involvement in like athletic sports something that pushed you toward that field? Because obviously injury is something that you encounter,
Right.
or was it something else that motivated you to go down this profession in the first place?
You know, this being a PA was not my first choice, to be honest.
It
Yes,
wasn't mine either.
right. We are we are directed on the path and to what we're called to do and supposed to do, and sometimes that results in some twists and turns. When I went back to school to get my undergraduate at age 30, and my initial, like you said, you nailed it, with all of my activities and playing sports and everything, lots of sprains and strains and dislocations and all kinds of stuff.
I'm assuming you were involved, like you saw a lot of people in healthcare through various, like injuries.
Right. Yeah. Yeah. And one of my very first injuries, I was 12 years old. Now that I know what I know, it's probably like a, grade 4 ankle sprain. And, went to the hospital, went to our little local hospital, and I just knew it was broken, and, it's huge, and it wasn't broken, but just that atmosphere of the hospital and seeing the people around and what they wore and what they did and just the seriousness of it and the importance of it. At 12 years old, I thought, this is really cool. I'm going to be doing something in a hospital. I don't know. This is really cool. As I got older and made a lot of mistakes and a lot of wrong turns, and decided to finally get my stuff together and go back to school and finish my undergraduate. My path was actually physical therapy. I wanted to, and my love was geriatrics. I worked as a physical therapy technician in a hospital, and going in, I thought, it's going to be sports medicine. I'm going to, love, dealing with the sports injuries and all this. No. First time I saw an elderly woman with a hip fracture, that was it. I was sold. And went through the whole process of interviewing for PT school, doing everything. And a week later, got a letter saying that they had lost their accreditation. And so I just kind of said, well, okay, now what? So after, lots of solitude and silence and listening, changed my major to biology with a minor in chemistry, shadowed a couple of PAs. My sister works for an orthopedic group that has a couple of PAs, and shadowed them, and here we are. And
That's awesome.
When the path I thought was laid out with physical therapy, and it wasn't, you're crushed and you're devastated and you're what now? And, it's why the rearview mirror is so small. We're only supposed to glance back. But to reflect back, it's so much better. My career and my, what I do and my passion is it's just so much better for me and hopefully for my patients and the people I'm around. So
that's amazing. Like, especially like what you said, you're absolutely right. Like now it makes sense where you said it's like your path is guided, it's like you have one thing and then this is what you were meant to do.
Right. And
very inspirational story too.
What's that?
So it's a very inspirational story. Like, you didn't give up, even though you got in and everything was set. You went and you pivoted, and showing that resilience that's
right.
So another question, Candace, I have for you. So since you're doing a lot of the initial sorting out of applicants, what makes a personal statement stand out for you? So reading 800 something personal statements, what's if you were to give one advice for us for our pre-PA student writing their personal statement?
For me, first and foremost is, the thing that stands out to me first is grammar. um, with so many tools out there, Grammarly and things like that, run your paper through Grammarly, okay, before you put it in here. But just looking for that true, authentic story, truly, why do you want to do this? And do you understand what it takes to do this?
Mm.
What have you been through in the past that gives you that grit, that gives you that determination? Am I reading that? Am I seeing that in this essay? And there are some great stories. How do you tell your story?
Absolutely. And that's actually a very good point, because I tell, a lot of pre-PA students, whatever your personal statement is a reflection of your stories. If you're really not being involved in the community or doing mission trips or doing something that will make you stand out from the rest of the people that are applying, then, you're just going to get lost in there. It's like,
Right.
So it's like, start creating that story now.
Right.
So another question.
The key that you guys are both saying is story.
Right.
It has to be a story. Stories are typically compelling. If
Right.
it's just factual info and it's not laid out as a story, it's not fun to read.
Right. Right.
Yeah.
Right.
So say, for example, a student gets rejected from your program and it has nothing to do with the grades or anything like that. What improvements, so they met all the minimum requirements, but what improvements are you looking for in the next cycle that would make you want to interview them again, or at least kind of push them along for an interview?
Mm-hmm. We had one individual that I can kind of use as an example. She applied for this first cohort, interviewed, but did not get in. She reapplied for this cohort. One of the biggest things was, what did you do during this time to build your character, to improve yourself? Mm-hmm. What did you see? What did you do? And again, was it improve on your writing skills? Was it go, see another variety of PAs in different fields? Was it to get different community service? What did you do, during this time to build your character and to change? And how did you change as a person? When you left the interview, what did you immediately feel you could improve on?
That's really good advice. So you want to see some type of growth from cycle to cycle if they're applying.
Yeah.
That's amazing.
But I think, again, it's a matter of, paying attention to detail and knowing who requires what, and do you have that, and take your time and go through that application process.
Perfect. So if our viewers want to learn more about your program, obviously they could visit the website. Is there any email that you would recommend if they have any direct questions to get more information?
If they just want to email the pa.program@mtsu.edu, that actually comes to me as well. So I watch a couple of different emails all throughout the day.
Amazing. Okay.
And that is also accessible by faculty. So
awesome. Well, Candace, thank you so much for your time. This was very valuable. I'm sure to our pre-PA audience, and as well for Jacob and I. There were very few things that you said that really kind of like stuck in my head, like that rear view mirror. Like I was like, oh my goodness, that's such a So thank you so much for your time. We really appreciate it.
Thank you. I wish you guys the best with your product, and
thank you.
I appreciate your time, talking today.
Yeah,
thank you. We appreciate yours as well.
All right.
We'll be keeping in touch, and we'll see you soon.
All right, perfect. Thank you.
Be well.